I'm part of the education team here at MS. And as we start, we acknowledge and pay respect to the traditional custodians who are present on whose lands we meet today. We acknowledge the deep feelings of attachment and the relationship of Aboriginal people to country, and respect the cultural authority of the elders in each community. All right. We've got a little bit of an introduction to Sally. A lot of you have probably met Sally or come across her in her presentations. So I'll just paraphrase, if you like, Sally. Yep. So Sally Shaw is a psychologist who holds a particular focus on the provision of information, education and support to people with neurological conditions and chronic illnesses and the health professionals that work with them. And is it correct, Sally, in 2007 you joined the team at the Eastern Health MS service, and she works as a consultant psychologist at Box Hill Hospital as well as in private practice, because I believe you're based here at the Nerve Centre. So she's based firmly within a positive psychology framework and drawing largely on cognitive behavioural therapy and acceptance and commitment therapy. Sally works with clients to increase their ability to be strategic while moving forward in life. And we're really delighted that Sally could present this webinar. And I know myself that I'm very keen to hear the content, because Christmas is something I personally struggle with. And I'm sure all of you have got your own experiences, and we please encourage you to share and comment and ask questions throughout the webinar.
Great.
Okay, and of course I just need to put the little disclaimer in here about informed choice. So this presentation has been prepared and is presented by an independent expert in Sally. The views presented are not necessarily the views of Multiple Sclerosis Limited, and individuals are encouraged to seek further advice regarding the relevance of the information presented for their situation. Okay, and now I'm going to hand over to Sally.
Thank you very much. Hello, everyone. Now, I actually can't see myself, so I'm going to position, you can see me a little bit on that screen, to just see if I'm in the right spot. I might just move that down a bit. Sorry, everyone, I just want to make sure that that's, okay.
Yep.
Great. All right. Hi, everyone. Thanks for attending today. This is a great topic because it's something that we all use words around this. Oh, Christmas is coming. You know, how are you feeling about Christmas? Oh my gosh, it's so stressful. I've got so much to do. I'm so busy. I don't have enough time. I've got to find that present. I think everybody kind of falls into that rhetoric leading up to Christmas. And I think it's fantastic that we're running a webinar in November, because Christmas isn't here yet. It's only November, and yet the stress that is associated with Christmas has certainly landed already for most of us. We're already in conversations with our family and friends about what we're doing and where we're going to be and what's expected of us, and that's already starting to make some people feel uncomfortable. So I think it's a great webinar to run. I'm really pleased to be running it, and hopefully it will be kind of light, but I really hope that there'll be at least one or two little things that you can take with you at the end of the webinar that might change your perspective a little bit on how to cope with Christmas stress. Okay, so I want to show you what you're expected to do for Christmas. This is a picture of how your Christmas tree should look and how your Christmas present should be wrapped. And I can tell you that my floor has never been this clean, nor will never. I vacuumed the other day and my floor was not this clean even 3 minutes after I vacuumed. So you can see the picture that is portrayed to us in the media of how our tree should look, how our floor should look, how our present should look. And really, this is how I look leading up to Christmas, which is just essentially very tired. I don't know if that picture comes up on yours. Yep.
It does, but I'll just let you know, Sally, I have actually just hidden your webcam because it is a slow connection.
Oh, okay.
So we'll continue with the slides, but
Great.
we're not able to see you at this present time.
Oh, well, that's probably a blessing for everyone. So you can see the slides, so that's good. So you can see the picture of this woman who is clearly tired and looking at the clock and really stressed about what's going on with Christmas. And I think that's a lot of our experience. So my aims for today really, you know, the webinar's about surviving Christmas. We want to get through it. And a lot of people that see me say, I just can't wait for January. You know, I dread Christmas. I don't look forward to it. And I'm just looking forward to it being over. I learned really early on that it's not a great question to ask people, oh, so are you looking forward to Christmas? You know, in my line of work as a psychologist, most people are very, very stressed leading up to Christmas. And so now I say, how are you feeling about Christmas? Because I know that for a lot of people, it brings much more stress than it brings joy. So a good idea to identify that early and really try and do something about it. So the ultimate aim is to survive Christmas. In fact, with my background of positive psychology, as Catherine mentioned, I would love for us to aim a little higher than that, not just to survive Christmas, but to enjoy it. Today I'm going to give you a little introduction about myself, and then why Christmas is so stressful. We're just going to have a look at the factors that I'm sure you could all name on one or two hands, the external factors that have an influence in the way we cope with Christmas, but also having a look at some internal factors. So having a little bit of an examination of your own expectations and maybe your perceptions of other people's expectations on you and how important that is in your enjoyment levels of Christmas. And really I aim for, as I said before, just coming out with a couple of basics that might assist you to enjoy your Christmas and the lead up to Christmas. So, as a way of a little introduction, I wanted to talk about the framework that I use when I'm working with people with MS, things to consider that I would really love to empower anybody who has MS to consider themselves in this kind of health and wellness framework. And so just to run through the dots very, very quickly, I think if you have MS in your life, it's very important to be aware of the information that's out there and to have a level of knowledge that you're comfortable with that makes sure you can make informed decisions about your own health and about life generally. So we need to make sure that we're appropriately educated. Also exercise and nutrition, just to have a little look, like this is almost a checklist for you to have a little look on where are my beliefs about exercise and what do I think would be good for me and for my physical body in terms of level of exercise per week, and have a little check-in to see whether you're meeting those needs. So it's all very well and good for most of us to say, oh, I should do 30 minutes of aerobic exercise every day or 3 times a week. And a lot of us have that belief, but not many people will actively make sure that their behaviour meets their belief. So it's a good idea to have a think about it and what's best for you given that you have MS, and nutrition as well. Medication and symptom management, making sure that you have a firm belief that the medical professionals in your life are advising you appropriately around the best medication for you, and making sure that they're aware of your symptoms and how to assist in managing those symptoms really well. Employment and practical strategies, it's very important if you're living with MS to think about things like the NDIS, particularly at the moment, that's coming into a lot of regions, either now or next year. We all know how quickly years go past. So have a think about practical strategies that could assist you in living with MS. Centrelink, employment concerns. Do you have the phone number of MS Connect, for example, to give them a call to discuss any of these things with them? And then, of course, within a health and wellness framework, there are the 3 ones at the bottom that I've highlighted because that's where psychological support can assist, or working with a psychologist can be really helpful in stress management, in exploring the support that's available to you, but also in spirituality and finding meaning. I thought this was a really interesting point. As I came across it this morning, I'd already prepared all of my slides for this and passed them on to Catherine, and I was reviewing the slides this morning and I thought how interesting it was that in a presentation around Christmas, there is not a dot point in this slide about spirituality or about religion. So I found that an interesting reflection on my own frame of reference of what Christmas means to me, because there hasn't been religion attached to that for a number of years for me, but for a lot of people there is, and it's very important. And as human beings, spirituality and finding meaning, whether that's within a formalised religion or not, really adds to our life experience. And so I would encourage you to pause for a moment, I guess, and make sure that that need is being met in your life as well. Okay, so as you've heard, I'm a psychologist and I work in these locations. My focus on working with people with multiple sclerosis is largely in part because I did a doctoral thesis in the experiences of people newly diagnosed with MS in the first 12 months following diagnosis, how they coped, what they thought assisted and hindered their coping with the diagnosis, and the types of lifestyle changing behaviours or activities they engaged in. So I guess that's a complicated way of saying, you know, lots of people changed their diet to a vegan diet. Some people just drank more red wine. People newly diagnosed with MS might tell everybody they've ever met, and some people don't want to tell anyone at all. Lots of differences that we see in the research amongst coping strategies, but certainly, I'm not going to go into it now, but certainly there's not one size that fits everybody with MS, because as I'm sure you're very well aware, everybody with MS is very, very different. The reason I had such an interest in this being my research topic was because when the university asked me what I was going to study in this degree of health psychology, I didn't know what I would look at, but I knew that I had to be passionate about a topic in order to not spend, you know, the next 6 years procrastinating. I knew I want to be really interested, and I was diagnosed with MS in that first year of starting that degree. So all of a sudden I had this real focus of something that I was very interested in, which led to that research, which then led to this work that I do now. So it's been something that's been an interest for me on lots of levels. I guess the last thing I want to say to introduce myself before we launch into this is, and you have to listen to my inflection here, the tone of my voice, I love Christmas. You know, that kind of sense of, you know, I really do love Christmas, but it comes with that little bit of, you know, I really do want to love Christmas. I love so much about Christmas. I am the crazy person that loves putting their tree up on the 1st of December. You know, I love all the homemade things that come home from school. I have little kids. You know, I love the things to stick on the table at Christmas time. And I do love wrapping the presents. But often all of that can get very overwhelming because there's so much more to Christmas than just the bright, shiny things. So keep calm and love Christmas is a nice little one there. So we're going to move to the Christmas stress poll that Catherine will assist me with, and it's really just to ask you, in your opinion, what makes Christmas so stressful? Because I don't think you would have signed on to the webinar if there wasn't a particular reason that you find Christmas stressful yourself. I was going to move the camera to you, Catherine, but I presume we don't need to.
Yeah.
Can you see?
I can see, yep, all good. Okay, so I'm just going to launch this poll, and you should be able to see it now. So Sally, when she was putting this webinar together, she did have a few more options, but the GoToWebinar program that we use only lets us do 5 options, I think. So we've got money concerns, family issues, organising Christmas Day entertaining, MS, fatigue/heat issues, and many of the above. And of course, if you've got anything else that really stresses you out, you're more than welcome to type it in the question box and I can read it out.
Yeah, I would really love for you to make comments. I should have said at the start, I guess we are kind of at the start. Please feel free to type comments or questions in, because Catherine's sitting next to me and she has her computer just sitting there. She's able to see all of your comments and you won't be interrupting the presentation at all because she'll see them and interject at the appropriate point. So I would love to hear from you because there are so many shared experiences. And it's extraordinary when you realise that other people find Christmas just as stressful as you for the same reasons or very similar reasons.
Okay, so we've got 100% voted now, Sally, so I'm just going to share that poll.
Great.
Okay, 9% of you say family issues, 18% of you say your MS fatigue or heat issues, and 73% of you say many of the above, so it's really a combination, isn't it? Yep.
Absolutely. And that doesn't surprise me because for most people it's not just one thing. I think in my work with people with MS, it is most commonly, actually I was going to say family issues, but it's most commonly communication-based issues around having MS and the added layer of complexity that that puts on demands of Christmas for that individual. But it is so many things.
There's just a couple of other comments that people have put in. Travelling.
Yes.
Seeing people I only see once a year. And
great.
Then, yeah.
I say great, as in that's such a good point, and really important for us to keep in mind that we put so much time and effort into meeting the expectations of people that we see once a year. So it's a good one, and we will talk a little bit more about that one. Thank you. So, oh yes, we click back on, thank you. So let's have a quick look at why Christmas is so stressful. And these external factors are the ones that you hear about quite frequently in the media and that you would talk to your friends and family about, I'm sure. When I Google, this is my research method, when I Google, stressful Christmas and put in images, the first thing that comes up are just this repeated image like you see on the side of the screen. This is literally from the cover of a book, 23 essential Christmas money saving tips. Like, nothing is simple. There are 23 of these essential Christmas money saving tips. Or there's another book for 15, habits to get in June to save for Christmas. Or there are so many books that are available to really reinforce, I think, in part, our anxiety leading up to Christmas, to remind you that this is going to be stressful. Money is the most cited reason for Christmas stress in the general population. I'm not sure about an MS-specific population in terms of Christmas stress, but money, we assume, is a fairly common denominator across all populations. So that is the one that people speak of. Mostly around present buying, often around entertaining, feeding so many more mouths. And somebody mentioned travel. Money is frequently tied to travel that you're expected to take at Christmas as well. Family is huge. For people that we, and I kind of put in inverted commas, love so much, these people bring so much stress to our lives. And the family stress that we encounter at Christmas typically revolves around communication and meeting other people's expectations.
And can I just make a point here, Sally? One of our participants has also said, I guess it's people not knowing about MS, understanding, not knowing why I can't be the person I was.
Yes, particularly if they say, but you look so well, or you get that so much, or are you better? I've heard that recently from somebody that's going through, their own diagnosis, probably 12 months on, and they're grappling with this concept that this is a chronic illness that they're going to have forever. And they're trying to incorporate this new knowledge about themselves and new, I guess, limitations, things to manage in their life, moving ahead. And there are quite a few people in their life saying, so, essentially, are you over that now? Is that finished? Like, can we all just move on and get back to normal? And she's finding that very difficult.
And I guess seeing family, it's that anxiety that people are going to ask the question, aren't they? Say something awkward or something that you don't want to answer.
Yep, absolutely. Time pressures is a big one. It's about figuring out, where am I going to carve out the time to do all the things that are required that are stressing me out. Present pressure. This is an interesting one because I actually, when we first started talking about doing the webinar, this was not one that came to mind, but this is commonly cited as a part of Christmas stress. And when I asked people just in my life, like the women that make coffee across the road, they were like, oh my goodness, it's finding the right present for the right person. And so I found this little cartoon, which I thought was quite good. I hope you like your gift. Shopping for it has caused me debilitating stress. This is common. This is a common problem for people. This stress attached to finding the right present for that person. I went to see a movie last night. Don't judge me for my movie choice. I went to see Bad Mums too, with a group of other mums from the school. And one of the opening lines was, oh my gosh, I'm so stressed because I have to find the right present for everybody I've ever met. It's this idea that we not only give presents to the 4 or 5 people in our immediate family, but now we extend that to giving presents to so many more people, whether it be children's teachers or neighbours or somebody at the local coffee shop, receptionists, people you work with. It's, people at church. There are so many people that have the expectation that maybe you'll be handing them Christmas presents or maybe just Christmas cards. But Christmas cards are exhausting, and I don't know if that's the thing anymore, but some people still do it. And so that expectation might be there. Where was my Christmas card in the mail might be a difficult conversation for some people. So we can't underestimate the stress that this brings. And then there's also the stress that's tied to not only buying the presents, but the entertaining factor as well. All of these people are coming to my house. I'm meant to be providing this big feast. Everybody says, let's keep it casual, but we all know that casual is just as much work as formal because everything still has to be organised. And then I found this, which is the nice little cartoon that says, everyone thought the turkey looked a little underdone. The turkey standing on the table. I thought that was a good one.
And Sally, I'll just put in, there's a few more comments. The MS as a concern is coming through. So Kath has said people who only see you once a year think because you're on medication you shouldn't have declined in any way. Or if the medications are working, they think all the symptoms should have been gone. And Marie also says you don't want to seem as being lazy. Body just doesn't work like it used to.
Yes.
And it's that judgment, isn't it?
That's absolutely right.
Yeah.
And we need to have a focus before we look at how other people are viewing us around Christmas. We really need to have a look at our own expectations, because we can't meet others' expectations if we're not meeting our own. And if our own expectations are unrealistic, then we're in for a world of pain. So I think that's where that journey will start. So the external factors of Christmas. Then we move to something that's a little more abstract, but I'm sure most of you will understand, that the crowds. And with that, which is more of an MS specific issue at Christmas, is that sense of feeling quite overwhelmed by crowds. Now I know that lots of people can feel overwhelmed in crowds. You don't have to have MS, but I certainly understand that this is a part of the experience of some people with MS, that sense of being unable to think straight, feeling very highly pressured in a situation like this picture shows, let alone, we haven't even talked about the fatigue that you would experience if you were expected to line up in those queues. I mean, that just is horrific to me, that picture. So overwhelm is an MS-specific symptom that can come with Christmas stress, but also heat and fatigue. If you're living in Australia, you are, destined for days of 40 degrees leading up to Christmas. Even Christmas Day is frequently that hot. People experience that differently. I'm sure everybody would have a comment, and please feel free to make a comment about your reaction to heat. Some people say that the first couple of days of over 30 or over 35 is okay, and then they really pay for it a few days later. Some people will tell me that once the temperature is, above 30, they're in big trouble for the rest of the season. So everyone's a little bit different.
And just on heat, Kath has said, and this comes up a lot, isn't it? Like, all the girls are in the kitchen. That often happens at Christmas, doesn't it? And I can't help due to the heat from the oven and scared of making a mess.
Yes. And so you just end up feeling horrific. And you might find, Kath, that these same people are saying, you just sit down, you don't have to do anything, don't worry about it, we've got it covered. So there's kind of a few different camps that your relatives can fall into. That's one of them. And it actually doesn't make you feel any better. I think people feel as though they're just like, don't worry about it, we'll do it all, which is very generous and very nice of them, but it actually doesn't make you feel that empowered. Whereas it would be lovely if they said, okay, so what we need you to do is grate all the carrots or whatever it is. Here's you're probably not grating carrots, actually, I'm just thinking about I don't know who eats grated carrot, maybe the red.
Chopping the salad, the tomato.
Exactly.
And then, grated carrot in there, couldn't you?
And they might have set up a little station for you, which there's a chair, there's a table, there are the things that you need so you don't have to keep getting up and going to the fridge, etc. You also don't want to be the demanding person that demands this special treatment. So often people fall into I just have to sit here and do nothing, and I'll just feel really helpless and like I'm not contributing, and it's very uncomfortable.
And Kath has just followed that up with, you feel really useless.
Oh, everyone's just so useless.
Something and
And you don't want to have a rest. A lot of people say to me, everybody tells me to just sit down and relax. I don't want to. I want to be in the kitchen. I want people to acknowledge that I want to be there, but I can't because the oven's at 180. And, if I stand up for half an hour, I'm going to be out like a light, or, just sitting down for the next 3 hours. So it's all about communication, and we'll get there. So what can we do to reduce stress from external factors? So those ones that we just looked at, they're the external factors most commonly cited in the research, and just the ones that you hear about on TV and in the media. So now we're going to, how can we reduce stress? Right. So a big one, big fan. I'm a big fan of being very strategic. So we really want to take control as early as possible over the things that can be controlled. So there are many things that can't be controlled. The really annoying cousin that will be there at Christmas asking the really annoying questions, we can't control that person. We can try, but you're not going to win. So there are some things that you can control that are external factors, and mostly you can do that by planning ahead, and that's why it's beautiful that here we are in November. So taking control over things include things like writing the list of Christmas stresses. So I'm a big list maker. I love it. And I'm not saying to you, you know, as you're driving from the shops to back to home before you put all the shopping in the fridge, quickly jot down a list of all the things that you forgot to get at the shops for next time. I'm not talking about that kind of list. I'm talking about today I'm going to set aside half an hour with a cup of tea to create, it might be multiple lists. There might be 3 or 4 master lists in the lead up to Christmas that I will then blue tack onto my pantry door so that I can see them, I can review them, I can add to them. They are there, they're a solid entity in my life so that I can anticipate all the things that I need to get done, as well as a list of Christmas stresses. What do you think is going to start stressing you out between now and Christmas? Writing it down will assist you to prepare for it and to get your head around it before it hits you. An example we can use is budgets. And I like this example because I'm not just talking about money. Budgets for presents. So a list of presents. What are the kind of present ideas you're thinking about, people? How much money are these presents going to cost? Where are you going to access these presents from? And sure, we can all talk about how great online shopping is now. And still, you have probably a week or two that you could do some online shopping and get it delivered before Christmas. But important to do that now and not, you know, on the 12th of December, when they'll be telling you that they might deliver on the 27th, and that's not going to work so well. But budgets for presents, budgets for entertaining, and we'll talk about delegating things in a sec, and for time allocation is very important. I love the idea of creating, when you're having a cup of tea and sitting by yourself, nice and calm, a budget of your time in regards to fatigue. And this can happen in several different ways. Have a good look at your realistic fatigue budget. You will still have to potentially do everything that you normally do, like work, like family matters, like your normal social commitments or exercise commitments. All of your normal routine will still have to continue between now and Christmas. And there is going to be a plethora of increased extra social activities that are going to be fired at you. And it's important for you to figure out, what will my time budget allow for and who gets priority in that? So sometimes people will say to me, yeah, you know, in the lead up to Christmas, I know that we'll have a lot more things to attend. And so I just try to say yes to everything because I don't want my kids to miss out. But in doing that, they know, and they can clearly state to me, that they will be wrecked the week before Christmas. It will get to the week before Christmas and they will have nothing left. And then everything will go downhill in terms of mood and ability and rational thinking. Everything will become a big hole for them. So the ability to plan and to prioritize is important. The time budget can extend to things like, okay, between now and Christmas there might be, is there 5 weekends? I actually don't know, 5 or 6 weekends left?
Yeah.
Oh,
yep.
Some people say, okay, before I get to the point of booking everything in, and maybe it's too late now, maybe a lot of you have a lot of things booked already, but they say, I'm going to do 1 social activity per weekend. And it's not a case of whoever gets in first is best dressed, because I need to prioritise the people who are very important to me. And I need to set some boundaries. So the children might get priority because they want to catch up with some of their friends before Christmas. That's fine. Your really close family members that you love might get priority and you need to make time for them in your calendar. Great. But if there is a tradition of your mother-in-law's cousin having everyone for Christmas cocktails on Christmas Eve between 7 and 9 p.m, and you have decided that, in fact, you know what, I know I've gone every year, I know that it's important for my mother-in-law that her side of the family, you know, show up for this thing, but in fact, I really need to acknowledge that I am a grown-up. I think one of the difficulties that comes with Christmas is that we often assume our roles in the generational order of our family, and by that I think sometimes we enter a room with people of older generations and we assume childlike mentality, or that childlike, I've got to do what my parents expect. And I imagine that most of the people that I'm speaking to are adults, And it is okay for you to say, thank you very much for your kind invitation. We're just not going to be able to make it this year. And we will discuss that a little bit more too, because some of you, I'm sure, are laughing at how simple that sounds and yet how difficult you know that is. Let's have a look at Christmas Day specifically, because this is a big one. I hear from a lot of people that say, okay, so we start the day in Albury-Wodonga, and then we come down to Melbourne, we try to be there by lunch, and then we're in Warrnambool for dinner. And I think, oh my goodness, and maybe that's a bit of an extreme example, but there are lots of people that travel significant distances or time distances, because remember, just travelling 20 kilometres in Melbourne, I know, can take an hour and a half on Christmas Day. So the locations are key, and some people love to have 3 different locations on Christmas Day. That does not mean that that is right. That means that's right for them. But that doesn't necessarily mean that you have to love having 3 locations on one day. However, it takes considerable energy and strategic thinking to be able to limit those locations if other people expect you to make them. I know that just from personal experience that I went from travelling many places on Christmas Day to, after establishing, you know, my husband and I, and after we had our first child, my husband and I decided we don't want to drive everywhere. And now that we are, you know, officially married and grown up, we're just going to call it. And so I said to my auntie, I'm really sorry that we can't come to Christmas. We've actually decided that we're going to do it this way from now. Like, we're going to start our own tradition. And I thought I was being really open, and my communication style, I thought, was really good. And I was telling her really with lots of time, so that she wouldn't put into place any plans to include us. You know, I thought it was really great. And there was a little bit of backlash, which I was shocked with my family not being okay with my decision. And so I had to manage that, but with a very firm sense of it's okay that they don't want me to miss out, that they really would like to see me, but it's okay for them to not see me on one day of the year, because they can see me any other day. Yeah, it's a hard one. We have to look at heat considerations. If you're living with MS and you know that heat is a problem for you, then you have to take this into account, because you could wake up Christmas morning and the forecast could be 40. Or potentially worse, a lot of people will say to me, it actually doesn't matter what Christmas Day is, but if Boxing Day and the day before have been 40, then that's going to be a bigger problem to me than any, you know, heat on Christmas Day itself. So we have to take this into consideration and use it to plan for Christmas Day. Can there be a plan B? If we inform people early enough, in November maybe, then could we live a plan B? Can we advise people early enough? And I've written there, can you own it? And I think it's interesting that I've put a full stop on the end of that sentence, because I must have really, you know, wanted to own it when I wrote that dot point, because it's very difficult to set up boundaries, but very important to, or else you're no good to anybody and you're not going to enjoy your own Christmas Day. And I've also put there plan a rest, because Christmas Day should be a day you love. And I know that my husband, his family have this great tradition where they have this massive lunch and then everybody has about 2 hours off. And by off, I mean they either go to their bedrooms or they watch a movie, they have a rest, somebody has a sleep. It's like 2 hours to do whatever you want.
Fantastic.
Yeah, no pressure. And then they'll reconvene or they're off to their next place. And I think that's genius. But look, it's not every family's experience. But on that point, just because it's not every family's experience last year doesn't mean you can't start making it your experience this year, because you are just as valid as the other adult in the room, whether it be the annoying sister-in-law, whether it be the mother-in-law who's difficult, your own mother, the expectations of your brother or your husband or whoever. You can start shaping a different reality for you so that you start enjoying Christmas just little bit by little bit.
So Sally, I might just pop in a couple of points that people have been making. Let me find the one that I was looking for. So this relates to heat and lists. You were talking about writing lists. Cass got a really good point. She said, I find a list of things like ice vest, meds is helpful, as the stress of leaving on time, you forget things that you normally would remember.
Perfect. What a perfect example. of things that you can control. Yes, you could have the esky ready to put the ice vest in and have it next to the front door so you can't actually exit the house without it. Great.
And Marie says, and this comes back to time allocation, she's saying children's school concerts, children's dance concerts, my nieces and nephews, looking forward to them, but so it might be about choosing which ones.
Absolutely. And could you discuss, now this is of course dependent on the relationship you have, but when you talk about nieces and nephews, could you discuss with their parent, so your sister or sister-in-law, whoever, I love being involved in your children's extracurricular. I love coming to the concerts, etc. Are there other ones during the year that I can put my hand up for? So I can come to the karate exhibit day in May, with an intent that I'm not going to be able to make the ones in November and December because it's too hot or I'm too tired or I'm too pushed or, So to have really frank and open and honest discussions is important in saying that I've got to acknowledge that it really depends who the other person in that conversation is and how open they are to knowing enough about MS to get it. And that was a point that somebody raised earlier. It's that people that just don't get it, that look at you, that think you are fine, or that don't understand, like, aren't you on drugs for that? Like, don't you feel better now? And that can be really difficult. Yeah, we'll talk about key messages.
And just one other one, Cass said, and it comes back to Christmas Day itself, we used to travel for many hours each Christmas, but have now said we only go to one place. Many complain that we wouldn't see them on the 25th, and they all blame me. It's that blame game, isn't it?
Yeah. So you can do a couple of things with that. You can say to them, I always love responding to those kinds of accusations, I guess, with a choice for that person to give them a bit more control. So you put it back to them and say, oh, I know it's really difficult, and it's difficult for us too, and we'd love to be able to do it all. But hey, let's find another date where we can catch up. So what about, the 25th of January, or what about the 14th of December? And you just give them the options so that they're the one left with, if they don't want to catch up with you, then they're the one left with, oh, well, no, we're too busy. Or they will choose an option and, obviously dependent on fatigue levels and things and locations, how you organise that. But I think it's important to let people know that you're not just cutting them off. You're saying, this doesn't work for me on this day. There are other options. Yep.
Love it.
Yeah. So internal factors. Listen to this one carefully. Managing your own perceptions of other people's expectations. So basically this is about having a look at what you think other people expect of you. So you might say, oh, my sister always, my sister is the hardest person to shop for. She always expects an amazing present and always expects something that costs a lot of money. And when people bring those kind of statements to me, I say to them, okay, so tell me a bit about the evidence that you have for that kind of comment. Because often it's just our perceptions of what we think other people expect. We don't actually know that they expect that. We just put it on them because that's the way it's always been, that they're the kind of habits or the patterns that we've formed together in a relationship, that you just assume that this distant cousin expects to see you on the 25th, and if you can't make it on the 25th, then they think that you don't value them. But in fact, you might not have actually had a conversation with them in August about a possible change of date and not doing it on the day of Christmas Day. So having a look at other people's expectations, but more specifically your own perceptions, is very important. Communication is so important. And I guess I've made an example there of coping with difficult questions or conversations. And we've raised a couple of those examples already. Has somebody just made a comment about that?
Just coming back to, the well-meaning people, relatives who know everything about MS and tell you what you should be doing.
Yes, see, that's just a perfect one to put in that dot point. It's the conversations. It's the, I saw something on 60 Minutes. It's about stem cell transplant. So when are you going to Russia? Or, well, you've just had, insert medication name here, but, you've just had Lemtrada, so why aren't you better? Or I thought you were on Tysabri, so why are you still limping? Or what do you mean you've got fatigue? I thought you were on that Galenia, or whatever, can be just excruciating because they don't get it. And you feel like you've explained to this person 15 times and they still have very unrealistic expectations of your life with MS. Making decisions can be very stressful at Christmas, so I want to just touch on that, particularly if you've got a MS symptom of cognitive dysfunction or concentration issues, memory problems, combined with heat intolerance and fatigue. Christmas can just be this minefield of uncertainty. How am I meant to make these decisions? And how do I know I'm making good decisions? And feeling just very overwhelmed is, of course, going to detract from your joy at Christmas. So we're going to have a chat about that. And say no. Oh, I wish I could bottle the ability to say no, and I would sell it, and I would make a fortune.
You would make a fortune.
Just take this tablet before you see that person, and then you'll be able to say no to them. And then, look, I have to apologise for this little meme, this little picture, but I love it. Look at this guy. Dashing through the... No. I hope you're laughing with me, or you're just laughing at me, and that's okay. You might think that I'm crazy, but I'm not a huge fan of cats on, you know, things like this, but I just thought that was gold.
Perfect. Yeah.
Dashing through the no. Okay, so what can we do to reduce the stress from these internal factors? The first one, we've just touched on it. Examining the expectations, so important. It's just so important. Because what you think might be going on might not be going on. What you think people expect from you might not be. And there is no harm, I don't think, to come from you having a discussion with someone about, hey, what are your expectations on me for this Christmas? Which is a really difficult conversation to have. So I don't want to pretend that that's easy for everybody to say, oh yeah, that's all it takes. I'll just ask my mother-in-law what she expects of me. But it might be a good opener to, I'm worried that you might expect X, Y, and Z, but in fact, I'm only able to offer X. And so I'm going to feel really like I'm letting you down if your expectations are not matching my expectations for this Christmas. So I'm wondering if we can have a conversation about it so that we can meet joint expectations. And at the start, I said the biggest hurdle to jump first is have a look at your own expectations. You might be somebody who, look, my husband says I'm very stubborn, and I think he's right. So I have very high expectations of myself, and that's not necessarily the healthiest place to be in a highly stressful, you know, very hot environment that is Christmas Day. So I have to have a good, hard look at my expectations of myself and say, is this realistic? And when I have that open and honest discussion with myself over a cup of tea, I can actually be very kind to myself, and I can say, you know what, it's not realistic. And as soon as I start thinking about it and putting it down in writing with my cup of tea, I realise that I can almost feel the stress coming as I detail all the things I'm going to attempt to do. And then I can see the solution as clear as day, which is delegate, start saying no, and not just start saying no, you know, dig your heels in and say no, but say no with the understanding that I am going to enjoy Christmas so much better if I don't have to rush from the picnic on Saturday afternoon to the pre-dinner drinks on Saturday, you know, evening, to the dinner that I just feel like I have to go or everybody will hate me on Saturday night. I will feel so much more relaxed and I will enjoy Christmas so much more if I just go to one of those occasions. And I know that about myself, but it's taken me quite a few years to get to a comfortable place where I can say it's just one a day for me, one thing, that's it, too bad. Developing key messages is key for those really difficult conversations that you'll have on Christmas Day or leading up to Christmas Day. So I want you to anticipate. So I think what I've written in the next one. So this is about personal information. So when people say, how is your MS? So I've got a great auntie who is, a lovely auntie I should say, who is lovely. She has all the best intentions. She's a wonderful woman and I only see her once a year. And she says, how are the kids? Oh my gosh, tell me everything. And how's your husband? How's your job going? And then her voice changes and she says, and how are you? I don't know if you can hear me, but she whispers and she gets very somber. And I want to say, I'm okay, you know, back with this, why are we whispering? And my husband will give me a kick under the table, or he'll, you know, shoot me a dirty look to say, and he'll say to me in the car, don't be rude to her, she's only asking. And I'm like, why does she have to drop her voice when she asks me about MS, as though, you know, I have this diagnosis that means my life is over and terrible, and, you know. So figuring out what do I want to tell people when they ask me about my health is very important, because you can come up with a few key statements that you think will satisfy those people that you only see once a year, and to allow you to escape. So what I mean by that is, look, a lot of people are on Facebook. You might see the cousins that you never see during the year on Facebook, or you might see your auntie, or you might. Facebook is a great tool for getting out of difficult conversations, because you can say, oh, look, you know, I have good days and bad days with my MS. You know, if you think they're really interested, you can say, fatigue is a big problem. Everybody's got their own journey. You know, everybody with MS is different. Do a bit of education for them generally is very nice. And then, hey, you know, oh, but it's a chronic condition, so I'm going to have it forever. I don't need to talk about it. Hey, tell me what that party was like last Friday that I saw you post on Facebook. You know, have some kind of out. And know that when you go to these occasions where there are going to be people that are either going to annoy you or not get it, or ask you questions that you would really prefer not to answer, have a key message as a response to just be nice and kind and appropriate, and then change the topic. And these people will know that you're changing the topic, but you're giving them a gift. You are saying to them, I want you to talk about yourself now, and I'm giving you a piece of information that I know about you so that you can launch into a new conversation and we can move on. That might be helpful.
And it is difficult, Sally, when you've got that person that just, you know, keeps asking, and even though you're trying to keep it very vague in your response, they just keep pressuring you for an answer, don't they? So that diversion technique of just, you know, sort of saying, oh, what about this, and changing topic, that's a really good key message, isn't it?
It's really important, because you're being generous. You're being a generous person by saying to them very clearly, I don't want to talk about this, but I'm giving you something to talk about instead.
Yes.
And you give them an open-ended question. Please tell me, how did that netball final go?
Yes, and most people love to talk about
themselves. Oh, they love to talk about themselves.
Yeah.
And they will get it clearly. Oh, she doesn't want to talk about that. So now maybe they feel a bit uncomfortable. Oh, maybe I shouldn't have said that, or kept asking her about it. But she's telling me to move on, and I can because it's about me.
Yes.
So it is a little gift, but it works very effectively. I've done it before, and that sometimes you'll get somebody sharing a glance like, oh, okay, now I get that you're telling me that we're not talking about it. Yeah. And I'll be like, yeah, let's move on. Because you might be in a setting where you don't want everybody to overhear it.
Yes.
So it might be something that you discuss with that person, but not with the uncle that's standing next to you.
Yeah.
You know?
Yeah.
Yeah. Looking at decision making, I just wanted to make the point that sometimes the decision-making process for little things as well as the big things can get very overwhelming for people with MS. And it might just be, what time are we leaving the party, or should we go to this first, or who's picking up the children from here, or what present should we get this person? Even just making decisions around buying presents can be very, very difficult. So please be open with the people that love you and the people that you love, you know, your people, the people who are helpful at this time. Be open with them and say, I would really like your assistance with some of the small decisions that I know might overwhelm me in the next couple of weeks. I have weekends sometimes where I'm just out. I don't want to make any decisions, and they're ones like, what are we having for takeaway dinner? I don't want to decide. It is beyond me to decide. Please just give me food. And so I will say to my husband at the start of that weekend, oh my gosh, I'm so tired this weekend. I'm not going to be the person that makes decisions. Can you do that this weekend? And he'll go, sure. And that's the conversation. And he knows that I'm just too tired. It's just not going to be a pleasant experience for me to be pushed into situations to decide literally between Thai and Chinese takeaway. I don't want to know, and it's going to stress me out if you ask me to make that decision.
Yeah.
But I'll eat whatever you bring, you know. Practice saying no. Please learn that it's okay to say no. And some of you are indicating that you have said no in the past around, particularly around venues for Christmas Day, and being able to minimise that and say we can't do everything anymore. We have to say no to things in the face of people getting upset, or your perception that people will be upset with you for changing the routine a little bit. can I just say that one thing that you can consider doing is practicing the specific wording. Something like, look, I don't think I'll be able to come to that. Really, and I'm bad, I'm a victim of this. It opens yourself up to being convinced, oh, why not? What else have you got on? Oh, I just don't know if I'll be able to come because I've got another thing that night, and so I'm not sure. Well, that's okay, you can come early. Let's just make it an early thing. Let's make it a brunch. Oh, well, I guess we could make it a brunch, and then you're in it. But upon getting that invitation, practicing, and then being very solid and kind, I'm really sorry I can't make it. Full stop. Don't say I'm really sorry I can't make it that day or that night or that afternoon. Just I'm really sorry I can't make it. And then if they're really pushing you, you say, I've got this budget of time that I'm working on. I'm having to prioritize lots of people in my life. And unfortunately, you can say, I'm practicing saying no. And you'll be maybe astonished at how many people applaud you for saying no.
Absolutely. Yeah.
You know, I've had people say no to things before, and I'm like, oh, okay, you know, are you busy? Oh, you know, we're only doing one thing that weekend, and the rest of the time I know I've got other stuff that's going to come up and shopping, and I think, oh, good on you. Well done. Yeah. Name it. Stick to it. It's okay to say no. Okay, last slide. Look, I'm already over time.
No, you're good.
Okay.
Yep.
Dealing with difficult people. So we've touched on these people already. And they're important. They get their own slide because we all have them in our life. So now it's November. I want you to today say to yourself that you're going to choose to have an enjoyable Christmas, because there are people who are going to be difficult in most of our lives. If you're on this webinar, I'm pretty sure that there's going to be difficult people in your life if you've identified that you're stressed leading up to Christmas. So I want you to choose, I'm going to have an enjoyable Christmas this year by minimising my exposure to difficult people and by having a different way of looking at them. So I want to say this, it's not about you, which is interesting because you're in a situation with them and they're being difficult, and often it's them being passive aggressive. So people saying things to you or bringing up questions that you've already had conversations with them that you don't want to talk about. They can see that you don't want to talk about your MS or your symptoms, or that they don't get it, but they just want to keep talking on about, well, they've got a friend who has MS and they're running marathons, you know. You don't, no thank you, that's not helpful. Remember, it's not about you. It is about them. It is about them and what they are bringing to this.
Yes.
And if they want to challenge you on your fatigue levels, that is their business. They don't know what you are going through. It is not about you, okay? I hope that you're hearing me say that in the right way. It's not about you. These difficult people, it is about them, not about you. So try to shake it off, do a Taylor Swift, try to shake it off, or try to just let it, you know, run off your back, because it is not about you. And I think a way you can get that to be a little bit more cemented in your mind is by using this strategy. On the way to the Christmas Day barbecue or the Christmas Day lunch, where you know that difficult person will be there, I want you to predict their behaviour. Instead of saying, you know what, it'll be fine, it's Christmas, it'll be fine. Say, you know what, I know it's not going to be fine because I have this difficult person in my life. So I'm going to predict their behaviour. I'm going to predict the types of things that they are going to say that I find difficult. I am then going to predict my emotional response to it. So when this woman brings up the fact that her friend had stem cell therapy and now is climbing Mount Everest, I am going to know that she's going to do that. I'm going to also predict that that is going to make me feel an array of frustration, anger, sadness, overwhelm, a sense that the people in my family don't get me, and I am going to predict that that's how I'm going to feel. So that when this person does talk about Mount Everest, and when I feel the way that I predicted, instead of feeling all of those emotions and just being drained of your own life force, you will be able to just start ticking boxes. Oh, I predicted this person would say this, and I predicted that that would make me feel this emotion. How interesting that she has done the same thing to me again, and how interesting that I am going to choose to enjoy Christmas other than this difficult person, because they have I have predicted exactly how they have reacted and responded to me. It can help. It can help to do that in the car on the way, because then they're almost walking into your trap of, let's see how many boxes. It's almost like playing a drinking game. you know, tick the box when they make this passive aggressive comment about my partner or my weight or my energy levels or my, oh, you didn't bring much, but I guess you can't because you've got a chronic illness, you know, statements. What can you do differently? Remember, we can't control their behaviour. Nothing, we cannot control them. So it's about you. This party's about you. It's not about you and it's about you. They're going to bring their own stuff, but you can bring your own stuff. So please think about the boundaries. Please think about the key messages that you want to send and how you're going to limit that, because you don't want to get into the same conversations that make you feel uncomfortable. So get into some topic changes. What kinds of things can I ask them to get them right off the course of the path that I don't want to go down with them again? Don't bite. When they make that comment, that, you know, that horrific comment, don't bite. Just let it smooth over you and change the topic. And they will be shocked that you're not biting this year, and that will give you a sense of satisfaction, because you'll think, you know what, I've done it before, I don't want to do it again, I'm going to rise above it. So the basics. Plan early. It's great that you're here in November and you can start thinking about what you can control and your lists and minimising things and saying no. Prioritise yourself and those that are important to you from January to November, not just the people that you see in December. Yeah. Don't prioritise them. You know, let them know that that you're so happy to catch up with them on another day, but that it's just not a great time this year for doing that. Let's find another day. Do you have your calendar with you? Have you got your diary? We're on the phone. Let's book something now. So you're not making excuses, you're not getting out of it, you're just rescheduling it for another time. Don't forget your routine. Look, I'm going to be really annoying and write exercise because it's super important. And if it's part of your routine now, please don't let it drop over Christmas. Find another way. If it's getting too warm for you to exercise outside, please find another way, whether it's an air-conditioned gym or in your home or swimming, or, you know, dare I say, getting up early. I have a new puppy, which is good because it means that I'm exercising every morning, and I'm getting up at 6:30 and I do it every day, and I'm annoyingly that person that says, I wish I did it earlier, because the benefits are real for just a quick walk around the block. And I know I'm going to have to get up earlier and earlier if it gets really hot, but it's so important. Be mindful of your Christmas. You know, be in the moment that you've designed to be enjoyable. Don't stress about what happened at the barbecue yesterday or the things that you haven't done yet. And then one of my favourite quotes ever: what other people think of you is none of your business. It's attributed to Deepak Chopra, but I've got to say, I saw Ricky Martin say it. It doesn't mean so much more than Ricky Martin said it. I'm so embarrassed. It should be from, you know, some kind of guru, which I guess it is. But I heard it out of the mouth of Ricky Martin when he was saying how he coped with, you know, the media and blah, blah, blah. And I just thought, imagine if we could live our lives. What other people think of you is none of your business. If you are managing your fatigue well, if you are living in a health and wellness model where you are feeling empowered in managing your MS, when you know your routine and what works and what doesn't, then own it and continue it through Christmas, because then you've got a chance of enjoying Christmas. And what other people think of that is really up to them. They can think whatever they want, because it's not your business. Unless they bring it to you and want to have a discussion about it, and then you can educate them about your decisions and why that's so important to you to be doing what you're doing. It's just not your business how you perceive them thinking about you. Yeah.
Fantastic.
Yeah. All right. Thank you, everyone. And I put good luck there because we are trying to survive Christmas, but I do think if we bring it back to the basics of really choosing to enjoy bits of it that we can control, it will be a much more pleasant outcome for everyone. Thank you.
Wonderful. Thank you so much, Sally. And I might just sum it up with Helen's made a wonderful comment here. It's a pleasure listening to someone with MS. Your explanation and reactions are so relatable. Thank you.
Oh, thank you so much.
And I really feel like the webinar was that, and I hope you've picked up lots of great tips. And please share it with the MS community, because I know that many of you would know we have a webinar library, and this particular webinar will certainly be added to that library this week. So if you know anyone in your community that would benefit from this webinar, please let them know. So I'm just going to finish off with a few more slides just to finish up the webinar. So just bear with me. Okay, so as I mentioned at the beginning, you can always contact MS Connect on 1800-042-138, or if you prefer, email msconnect@ms.org.au. And I'm actually positioned right next to the MS Connect team, and they're a fantastic bunch of people who are more than willing to help. So if you need to get in contact with MS and you haven't before contacted MS Connect, please do. And just about the National Disability Insurance Scheme, which is rolling out throughout Australia. So it's a major change to the way disability support and services are funded and delivered. It's available to people who are under 65 and satisfy various residency requirements and are able to demonstrate that their disability substantially affects daily living. And you can contact MS Connect to talk about satisfying, if you meet the NDIS. And of course, if you are over 65, you can also contact MS Connect about linking into aged care. Okay. So MS Connect can help you to understand the eligibility requirements, understand the pathways to access the NDIS, prepare you for a planning conversation, understand your current supports and any unmet needs, and develop your goals. And I know someone in the comments made a comment about not having an air conditioner, and that is something I would certainly be calling MS Connect and having a chat to them about. And so MS is a registered provider in New South Wales, ACT, Vic and Tas, and you can see there we've got pre-planning prior to your conversation in all areas, your NDIS conversation, support coordination and connection. You can see in Victoria there's short-term accommodation, community participation in New South Wales, and some various other supports, but please contact MS Connect for further information. And there are the details again, and of course you can jump on our website, there's a wealth of information there. And of course we really value your feedback. So after this webinar, if you stay online, there will be a short survey, and I know Sally said to me before she's looking forward to hearing the feedback from this particular survey, this particular webinar. It's the first one we've done of this kind, and we're really hoping to get it out to the MS community, so please give us your feedback. Okay, beautiful. So that's it for today. Thank you so much for jumping online and participating in this webinar. And we'll say farewell to you today and all the best with Christmas, as Sally said.
Yeah, thank you. Thanks, everyone.